بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين نبينا محمد عليه وعلى آله وأصحابه أفضل الصلاة والتسليم. Tonight we have a meeting and presentation about the medical insurance company, and our friend will tell us about the new policy and the coverages, and any questions will be answered throughout the presentation. Thank you.
Thank you. I'm waiting for a microphone, so I'll start, and if you, hopefully you can hear me. I'm a movie star tonight. Thank you very much for having me this evening. My name is Denis Deschaines. You can see it right there. I'm with Great-West Life, and I'm from Ottawa. And I'm here this evening to help you understand the health and dental plan that started on February 1st. What we are trying to do is answer all your questions during the presentation. So if you do have any questions, let's just do it as we're going through the presentation. That way it makes it easier, and probably the question that you have is the same question that somebody else has. Now, we've done a number of presentations across Canada, and so the questions are the same. So there's a lot of answers I already have for you, but that doesn't mean I have all the answers to your questions. So I'll continue until I get a mic, and we'll take it from there. I'll start off by answering the question, why is there a program? Why is there a program on February 1st that started for you? Well, the Cultural Bureau has a challenge in that there are many of you across Canada. And if you don't know it, is that the health and dental in each province is very different. So what they wanted is they wanted a plan that would be the same for everybody across Canada. And to do that, they chose us, the Great-West Life, to be the administrator of the program. So that's why we're here this evening. Now I'm going to give you a 30-second commercial on Great-West Life so you know a little bit who we are. We are one of the largest health and dental insurers in Canada. We have over 9 million Canadians that we have their health and dental benefits. So we're able to handle your health and dental benefits quite clearly. If you want to know more about Great-West Life, you can go to our website at greatwestlife.com. That's it. That's my commercial.
If you want, I can help you with this.
Oh, sure. That'd be great. Thank you. Now, I'm going to address your situation in BC because it is a different situation than students in other provinces. So let's deal with that right away. Number one, that person's not going to get me in the camera there. Number one, how many of you have your BC health card? Okay, how many don't have their BC health card? Okay. How many of you that have your card, is it active? Because we're finding out there's a lot of you that have the card, but it's not active.
What do you mean by active?
That you've paid the premium. That it hasn't expired. Okay? All right. You know that in British Columbia, there is BC Medical Services Plan. That plan is mandatory. That is, legally, you have to apply for that plan. You have to join the plan. And so the first message I have to give you this evening is that if you haven't applied for your BC healthcare, you must do so. Now I'll explain how that's going to happen. If you have the BC Health Card, We'll also explain what that means from now on in terms of paying the premium. We're going to try to be very helpful to you, and I think you'll find that interesting. The next slide. How do I apply for the BC? So those who haven't applied, how do you do it? Well, we are now going to administer the BC healthcare plan for the Saudi students in BC. You will now apply for your BC healthcare through us. I have some application forms with me. I don't have enough for everybody, but I do have some, and there's some on our website. What you will do is you will fill out that form. We'll need a copy of your study permit and your ID. You will fill out that form, you'll sign it, and you will send it to us. We will make the arrangements with BC Healthcare. Okay, like this? No?
More volume.
You might need to also stand
Hello?
closer.
Are we okay? Is it on?
Yes, it is.
Okay.
You might just need to stand closer to this, like, I don't know if you,
Over here? Over here? Over here?
was it?
Is that better? Doesn't make a difference, does it?
Go ahead. Try it now.
Hello? Is that better? Okay.
Go ahead.
Okay, thank you. So what I was saying is that you will apply for your BC healthcare and you will send your application to us. We will administer that application directly with BC Healthcare. And as you know, BC Healthcare comes with a cost. It's a cost of $64 a month. We will make the arrangements directly with BC Healthcare. They will bill us, and we will pay that premium through the plan. So you will not get a bill. So we're trying to make your life easy. All you have to do is apply. We will take care of the rest. This is what the application form looks like. I'm not going to go through all of it, but this is what you will have to fill out. I have copies here that I have. Again, I don't have enough for everyone, but I do have copies for some of you, and I certainly can give you some at the end of the presentation. Yes? Oh, okay. I'll try to do that. And that's what your BC Health card looks like. I'm sure that some of you have it, know exactly what it is. This is the card that you would use for healthcare in BC. What that means is that this is the card you will use when you go to a hospital, when you go see a doctor, or where you need lab tests. This is the card you will use. Sorry. Now, what if you already have your card? Some of you already have your card. What do you do? Because now you're getting the bill and you're saying, well, how can I change that? If you have your card, you will also fill out that form. But it's a little bit easier for you because all you have to do is put your name and address, put in your current number, sign it, that's it. You give it to us. We then will advise BC Healthcare. They will now send the bill to us. So you will no longer get that bill. So this is a big step in trying to make the process simple for you in getting your BC Health card and not having that you get a bill and you got to pay every month and then you got to send that and we got to pay you back. This will all be direct through us. Any questions on that? Now, our last night when we were in Kamloops, there was a number of your colleagues, some of them who still had their BC Health card but had not paid their premium for some months. And if that is the case, we can't take responsibility for the premium you haven't paid. We can only take responsibility from February 1st onward. So we encourage you to pay your debt to the BC Healthcare and submit your bill to the cultural attaché. They'll be responsible for reimbursing you. We can't do anything before that date. Okay? BC Healthcare, pretty clear? Yes.
For newcomers,
Yes.
as far as I know, they should stay for 3 months.
Yeah,
Then they will get back their BC card.
that's right.
So what's the after this card insurance? Should they wait the 3 months, or they will get it back as soon as they come in?
No, well, newcomers, when they arrive, should apply right away.
Okay.
Send us the application, we will process it.
How long will it take to?
Well, it's going to take the waiting period to
Three
process.
months. Okay. This is for the BC. What about for the BC in BC?
No, that's for the, that's the same thing.
No, sorry, it's a
Okay, the SACB is this card.
yeah right away or should
This
they-
card is right, this card covers you in the meantime.
Okay.
It's your, this will cover you.
Okay. So newcomers, they should apply as soon as they come back.
That's right.
And they will get the your insurance, but the BC will they should wait until.
Will come in later.
Okay.
Okay? Now, just so it's clear, if you don't have your BC card and let's just say something happens, you have to go to the emergency, you will get care, but you'll be billed. So you'll get the bill, you'll send it to us. We'll pay that service. But we will then send you a letter saying, apply for your BC card. Because the next time you send a claim, we won't pay it. So just remember that. You get a one shot. You get a freebie once. That's it. After that, we will then say, no, you should apply for your card. Yes.
If I apply for the BC card through Great West, how
Yes.
long does it take to get the card?
We will process it right away. Unfortunately, BC Healthcare goes to them, and then it takes them from 4 to 6 weeks before you get your card.
And meanwhile, for any like emergency case or if I needed to go to the hospital, do I just send? Oh, I can
You use this.
Okay.
I'll explain that. So this is your backup.
And excuse me, and this will be within a couple of days to issue this one?
Yes.
Okay.
Well, this one, for those of you, and I'll ask that right now, how many of you have this card? So that's a good number. So it didn't take you too long to get it, for most of you, I would think. Probably some of you haven't gotten it yet because it's stuck in the mail, possibly. We've had that problem. But once you update your address, or if you're a newcomer and you update your address, we process it right away, and you should get it within a week. So it doesn't take very long. All right. Let me move on then to the SACB plan and put BC Medicare aside for now. Oh, sorry. Accompanying person. Yes, I should mention that. If you have an accompanying person, I don't think that applies to you in particular. It applies possibly to the other group. But if you know of an accompanying persons are not eligible for BC healthcare. So the only card that accompanying person, the only card that they can use is this. This is all that they have.
So BC will not require them to issue a BC card?
No, because accompanying persons are here on a visitor's permit. And if they're on a visitor's permit, they're not eligible for BC healthcare. So that's why we have the...
So those who accompany their wives, for example, our wives accompany their husbands.
Yes.
And both of them are students, private students, so both of them need...
Both of them need their BC
Okay,
healthcare.
so it depends on the visa itself.
It depends on the visa. If you have a visitor's visa, you are not eligible for BC healthcare.
If you have the study permit,
If they have the study permit, then they have to apply for BC healthcare. Next. Okay. Now let's talk about your plan. Your plan covers you as students. It covers your dependents, that is your spouse, your children, and it also covers accompanying persons. That's all I have to say on that. Very, very, very simple. When does your coverage start? Well, as you know, you got your cards. It starts February 1st. When does it end? It ends when you're no longer a sponsored student by the Cultural Bureau. What the Cultural Bureau does is that we exchange data on a regular basis. We're now doing it almost every second day. So when you're no longer on their database, it comes to us, your card is terminated. So even if you presented your card, it would not be recognized. That's it. All right, the important thing, what coverage do I have? So in other words, what can I use the card for? You could use the card for 3 different levels of coverage: basic care, supplementary health care, and dental. Now, the basic health care is the care that you get through BC Medical Services Plan. That means hospitals, doctors, lab tests. You use your BC healthcare card. So let's see what that means, just so that you know, in case you have any questions of what basic care is about. So next slide, Mike. Thank you. So the first one, in terms of coverage, is what we call outpatient, which means emergency rooms, or you have an accident, you cut your hand, you have to go to the emergency room. That's covered. You go for a one-day surgery, because sometimes you just present yourself to the hospital, you're there for one day, you're released right away, and you're sent home. That's what they call outpatient. But that's covered by BC Healthcare. Next. The next one, you could be admitted into the hospital. So if you're admitted into the hospital, you need surgery, you need to be put in intensive care. If you have a dependent, and that person, the baby, the child has to be put in intensive care. Nursing, drugs, tests, all the services in the hospital are covered. But again, that's with BC Healthcare. Unless you're in your waiting period, then it's covered under your plan. You're also covered for doctor's visits, specialists. So if you need to see them, they're also covered. Now, supplementary health care. Now let me find myself in my notes. Supplementary health care. So the next slide, please. So for supplementary health care, all the benefits I'm going to describe, they're reimbursed at 100%. There's no deductible. That means there's nothing that's held back or something that you have to pay, you don't get reimbursed. And you have a maximum of $1 million. Now, believe me, it would take a lot of services for you to consume to get to $1 million. So I wouldn't worry too much about that maximum and how it applies to you. The first coverage that you have under your, I'll take that card out, under this card, is drugs. Drugs is very important because you never know when you may need it. You may need it, you go see a doctor, you have a flu, you've got a virus, you need antibiotics. You will need this for drugs. Now, what's covered in the drugstore? I'll make this very easy. If you've ever been in the drugstore, there's the back part where the pharmacist is and they're working. Those drugs that are behind, those are the drugs that are reimbursed under your plan. All the drugs in front of that counter are not reimbursed. So even if the doctor gives you a prescription for aspirin, no, that will not be covered. Aspirin, you can go buy it on the counter. You don't need a prescription for that. Only drugs that you absolutely need a prescription for are covered. The pharmacist knows what to do with the card. There are codes on the card that the pharmacist knows. They just enter those codes in. The drug goes right through the system. That's it. There's no bill to you. It just goes straight through. I'm sure some of you have already used it.
Do I have to pay now at the pharmacy?
No. It just goes through. Now, the drugs are also reimbursed on what we call a generic equivalent basis. So drugs, there's a brand name drug, and sometimes there's what we call a generic. If a generic exists, you'll be prescribed a generic drug, not the brand name drug. That's what we'll pay for. But you're getting the same drug. So that's not the question. It's just that it's cheaper than the brand name drug. Next slide. Some drugs, some very expensive drugs, and drugs that are very, very particular. For example, if someone is suffering from cancer and is released from the hospital, they're prescribed drugs to help them cope with their cancer. Some of those drugs are very expensive, and expensive like $50,000 a year. Those drugs have to be authorized by us first. We have to say yes before you can get them. But your pharmacist will know that, because when he uses or she uses the card, they will get a message and say, oh, you need authorization, and they'll help you with the process in getting that authorization. So you'll get a message, they'll tell you what to do, just so that you know. But I would say for 99% of you, that will never happen. But it may happen if you are suffering from a very specific disease or you're very sick. So just so you know. I have to be a movie star. Now I gotta hold so many things. When you get your drug claim, you'll be given a 30-day supply of drugs, just so you know. However, if you're suffering from a disease, let's say you have asthma, and if you have asthma, then obviously you need your medication all the time. At that time, you can get 3 months supply rather than just a month. Just so that you know that you can, these are the limits that you have when you go get your drugs. Any questions on that? All right, next slide. Oh. Next slide, sorry. Yeah.
Excuse me. There's a question just came asking about why should we pay in cash for some medical centers instead of if it's not covered by BC and we present our legal medical insurance and they will not accept it, they will ask us to pay in cash.
Yeah.
Could you please just...
Okay. The question that we have is, why is it that for certain medical services we got to pay up front and we can't just have the provider bill us directly? And that's a very good question because we get it everywhere. In the Canadian medical system, the professionals that are providing you a service, such as a medical doctor, they can charge what they want outside of BC healthcare. We have no control over that. And we can't tell them what to bill, and we can't tell them how to bill it. The practice of a number of clinics, and we visited a few, is that they don't want to deal with any provider. They say, I'm sorry, all our patients pay, they then will have to make their claim to their provider. So it's not a question of not accepting the card, or they don't accept Saudi students, or it's just a question of, doesn't matter who you are, this is their practice. The same would happen with dentists. I don't know if some of you have used your card for dentists, but I can tell you that some dentists Doesn't matter, any patient that they have, you pay them. They'll send your claim, they'll do that for you, but that's it. You have to pay them. So it's not a question of we can't get this done or it's because your card isn't good. It's a matter of these professionals have decided it doesn't matter who you are, you pay me first. And then you send your claim. So you will come up against that, and unfortunately that's what you'll have to do. Now, let me qualify that because we're working very hard to try to get providers to bill us directly. I'll give you an example of even yesterday in Kamloops. We had a student who needs a hearing aid. It was a $3,000 hearing aid. Doesn't have the money to pay for $3,000 and after that send us the bill. So we asked him, says, who is your provider? Who is the hearing aid center? He gave us the name of the hearing aid center. We contacted them today and they're billing us directly. So when you come up to those situations, I encourage you to call us and say, here's my situation, here's my provider, is it possible to make an arrangement with that provider? We may not be able to do it every time, but if you tell us, we have a chance to happen. Because when we call them and say, we'll pay you, they sometimes say, oh, well, that's very good, then now I'll do that. That's fine with me. And it works. So just keep that in mind when you come to that situation. Does that answer your question?
Yes, thank you.
Okay. The next benefit you have is up there is a list of medical services. It's a very short list. It's not meant to cover all the services that are available. On the website, there's this booklet. It has all the details. I'm not going to go through it all because we'd be here all night and I don't think you'd be very interested. But it's there for you. So if you have a question, you're saying, well, I need this. I need a crutch. You know, I'm in the hospital. I sprained my ankle. I now need crutches. Is that covered? Well, look in the book. It will tell you whether it's covered or not. And crutches are covered, just so that you know. So I won't go over the list. It's just there to give you an idea of what's available.
There's a question about the LASIK eye correction.
Yes.
Is it covered?
No. Sorry. The question is laser eye surgery covered? It is not covered. Next slide. You're also covered for paramedical services. These are practitioners such as chiropractors, osteopaths, physiotherapists, psychologists, massage therapists, and the list is all there. Those are the practitioners. But they all have a maximum. So if you want to go to a massage therapist, you can go up to, you spend $500 in a year. Once this $500 has been reached, then you don't have any other coverage. I mean, you can continue going, but now it's out of your pocket. I had the question earlier, do you need a prescription to go see these practitioners? No, you do not. So you can go to them directly.
But those who are authorized, right?
Yes, the practitioners all have to be authorized. That means they have to be recognized by the BC. So if it's a chiropractor, they have to be recognized by the BC Chiropractic Association. If they're a massage therapist, they have to be a member of the BC Association of Massage Therapists. So, but in most cases, they are. And if you're not sure, just ask. They'll tell you.
This is just a question about FlexMap, which is kind of medicine. It's really expensive, called FlexMap. Is that for rheumatism? I don't know. Is it the correct word?
The question is, there's a drug name, is it a drug named FlexMap?
Yeah.
And is it covered? I don't know. I've never heard of FlexMap.
Do you know what's rheumatism? It's the same thing in English, I don't know.
for rheumatism. I never heard of the drug, so I can't tell you whether it's allowed or not. The only way you would try is you use your card when you go to the pharmacy. They'll tell you. You don't have to buy it if you don't. You just say, "Is it covered?" They'll just look in the system and they'll say, "Yes, it is covered under your plan." Because there's over 7,000 drugs. I don't know them all. Next. Okay, vision care. Well, we already had a question on that. And vision care, you're covered for one eye exam a year. Now, what's not written there is that the eye exam has a maximum of $140 a year. But that should cover most eye exams. Usually they don't cost that much. I'm not sure what they are in BC, but I've never seen more than $140. So I think most of you would be fine. And you're also covered for eyeglasses and contact lenses to $400 a year. And so that's also what you have eligible, and there's some people have eyeglasses here, so that's something that you may find of interest. As I indicated before, laser eye surgery is not covered.
What about sunglasses?
Prescription sunglasses are covered, but not regular sunglasses that have no prescription. Yes.
So for eye exam and the glasses, it covers up to $540, 400 plus 100.
No, it's 140 for the eye exam, so that's one thing,
Yes.
and then $400 for the glasses.
Okay.
Two separate items. All right. You're also covered for out-of-country coverage. So let's say you travel, and you're traveling to another country, or you're returning home. You are covered for out-of-country coverage. The difference, though, is that it's only in case of an emergency. So you can't travel to go get treatment. It has to be because it was an emergency. So if you're traveling to the States and you slip and fall and you break a leg, that's an emergency. That's an accident. If you want to go to the States because you can't get an MRI here in BC and you want to go get it in the States, that's not covered. It has to be an accident. And I'll give you an example again. There was the wife of one Saudi student who is now in Saudi Arabia. She's pregnant, and she wanted her pregnancy-related costs covered while she's in Saudi Arabia. Well, that's not an emergency, so that's not covered. So just be careful that in terms of how you view that, it's for emergencies only. Now, if you are traveling, and I'll show you that in the back, but there's information in the back of the card. There's a 1-888 number to call in case you have an emergency in another country. This is very, very helpful. If you get, for example, an accident in the United States, you could easily get to $100,000 within a few days. And they will bill you. And they will hound you until you pay. But if you call the number, they will make the arrangements. So remember that when you travel, because otherwise it could be very inconvenient for you. Like, we'll pay, even if you don't have your card and you didn't call, we'll pay when we get the bill, but you will get the bill. They'll take your credit card, they will bill that credit card. I guarantee it. You can skip the next slide. And last but not least, you have dental coverage. You have dental coverage for 100% of the cost for what we call routine, basic, and major restoration to a maximum of $5,000 a year. Now, what is routine, basic, and major? Well, routine is dental exams, so going to see a dentist for a regular checkup. cavities, root canals, gum treatments. Major is crowns or bridges. Orthodontics or braces are not covered. So teeth straightening is not covered under the plan. Teeth whitening is not covered under the plan. We've already had that asked many times. So those are not covered items.
What about if you have braces but you want to follow up? Is it covered?
No. Anything related to your braces is not covered.
Cleaning is not covered?
Sorry?
Cleaning.
Cleaning is covered, yes. Yes. Even if you got your braces on.
Oh.
So that's fine. Cleaning, but not adjusting,
Oh.
because usually that's what comes into play.
What if for some reason I exceeded the limit of 5,000 in a really serious issue, for example, I mean leads to a surgery, would that be covered for an inductive recommendation?
No, we can only cover you up to $5,000.
No more than that.
No more than that. And you have to realize that this plan is not what we made it. You know, the Cultural Bureau said this is the plan we want. And so we are following what was given to us as instructions from your Cultural Bureau. So the $5,000 limit is not our limit, it's the limit that was set by the Cultural Bureau. Just so you know that, you know, don't be angry at us if that happens. But $5,000, believes me, covers enough services, but again, it all depends on the state of your teeth. Now, when you need treatment that will cost you more than $500, we strongly recommend that you send us the treatment plan before you get the treatment done. Now, the reason for that is because dentists can charge sometimes for services that are not covered under the plan, and it's important for you to know that ahead of time because you don't want to be surprised after. So what the dentist does, so you go to the dental office, let's just say, and they look at you and say, oh, you need a crown. And so a crown could cost $1,200 to $1,500 when you put everything in. He or she will make up the plan. They will send it to us through their system. So you don't have to take it and send it in the mail. They will do it for you. And you keep that in mind because, you know, ask them, say, send them the treatment plan, and they will do so. We will look at it. We will then get back to you and say, your dentist has submitted a plan for $1,200, and we can tell you that $1,200 is covered. So now you know. Or we can say, no, some of it is not covered. And so then you know that a part of it you may have to pay out of your own pocket. So it's recommended you do that. You don't have to, but you will be stuck with the bill after if it's not covered, just so that you know. And believe me, it's the same process we all have to follow. I have to follow the same process. It's typical process in Canada. Questions on any of the benefits? Okay. Okay, I'll find my notes again. All right. I believe most of you have applied for your card. So you have this card with you. So you know the process. For those of you who have not, you should be going to the portal. It's a very simple process. Put in your name, your date of birth. You will then be into the portal, and you must give us your address. Once we have your address, we will then send a kit to you that has your card and information about the card. We need your address because we have no other way of finding you. So you have to come to us and then we can then find you. So for those of you who haven't applied, we strongly encourage that you do. And if you know people who haven't applied, then please encourage them to do it. It's, again, a very simple process. Next.
Someone just asked about, is there any connection between the company, your company, and BC Medical Insurance, or this is a separate?
Yeah. Is there a connection between Great West Life and BC Healthcare? No, there isn't. BC Healthcare is a government program. We are a private enterprise. We are an insurance company that operates privately. So BC Healthcare, being the government, sets its own rules, and we do not have any influence on those rules at all. We can't change them. We can't tell the BC government how to do things. All we can do is try to work with them. And that's what we're trying to do, is work with what they are offering. But we can't change what they do and how they do it.
Excuse me. There's another one asking about his wife is delivering a baby within a couple of months.
Yes.
And he hasn't got the BC card yet, but he has already the new plan. Would that be covered, or he should apply for BC and the great will?
Okay, question there is that someone has not applied for BC Healthcare. The spouse is waiting to deliver a baby in the next few months. Should he apply for BC Healthcare? Yes, do that right away. He has his card, so this will cover him in the meantime, but he should go for his BC Healthcare card. And again, if that person's here or if not, we have the application form, so we can get that process underway fairly quickly. Go ahead. Skip that. Okay. Oops. Okay, you will get a package, and I think that I'm not going to spend too much time on that because most of you have your card, so you already know what's in here. You already received it. So, but for those of you who have not, once you've registered, you've given us your address, you will get a package that comes like this, and inside that package there is quite a bit of information. There's your card. There's a consent form. I'll talk about that a bit. There's a claim form, as well as other material that summarizes what I talked about in terms of what you're covered for, drugs and dental and so forth.
The question just came asking about he is living in a hotel and he already applied for the medical card.
Yeah.
And he's saying that I didn't receive it yet. It's been more than a week. More than 2 weeks.
See me after. See me after the presentation. We'll get your information.
And another question asking about the dental coverage. If it's exceeding the limit for a year, can we separate that between 2 years? So we can do half of the plan this year and the other half next year?
Yeah, I'll cover that. Okay, question on dental, so we'll go back to dental. So someone has expenses that, let's say, are $7,000. Can you split it over 2 years? Yes, you can, but the service has to be given in each year. So in other words, let's just say, I'll give you an example. You need 4 crowns, let's just say. So you need 4 crowns and that'll cost you $7,000. Well, you don't have to get 4 crowns done at the same time. If you do, then you're only going to get 5,000. But you can do 2 crowns 1 year, and you can do 2 crowns the year after. So that's a strategy that a lot of people use when you can. So in other words, split the service so that you can get the full amount paid, but you do it over 1 year and then into the other year. But the service has to be given in that year. in the new year. It can't be, oh, I'm going to get the 4 crowns done right away. I'll submit the bill for 2 and then I'll submit the bill for 2. No, it doesn't work that way. It's 2 that are done on the date they're done. You wait till the new year starts, get the 2 done in that year, and you're okay.
Another question,
Yes.
sorry for that. It's asking about the refund of the medical expenses. Sometimes, as you just said, you ask for charges. Does the refund take a long time to go to the student's account?
No. Okay, so what happens, I make a claim, I send it in, how long does it take? It will normally take about 5 working days to get your money back into your bank account. So directly into your bank account. So, but that's 5 days when we get it. So if you send it by mail, you have to allow time for mail. Sometimes the mail works very well, sometimes it doesn't work as well. But if you see that it takes time, then call the call center, I'll show the numbers, and ask whether the claim's been received or not. Because sometimes we may not have received it. And then you'll know where it's at. And if we received it, then we'll be able to tell you when it's processed. So that way you'll know if it takes too long. But I would say that 5 days is what you would expect to get your reimbursement. Okay? Move to consent form. Another one. There we go. In your package, you have a consent form. Now that consent form needs to be filled out by you. Now again, I'm hoping that most of you have done that. The consent form allows us to share information with the Cultural Bureau. This is something that they have done and asked us to do, and we understand that you've already done it, but you've done it under another form, but we can't accept that. We need something that's more specific for us. So this consent form is required. This consent form actually activates your card and allows us then to process your claims. Now, we'll still process your claims even if it hasn't been signed, but you will get letters from us saying, we don't have your consent form, please sign that form and return it back to us. So we're just saying, you have the opportunity to do it now, then do it. The consent form needs to be signed by anyone that is covered under your plan. So that could be you, your spouse, or any children you have over 18 years of age. So it's for people 18 and over only that need to sign. Any questions on that? Okay? No. We'll move on. That's your card. Let me just walk you through the card just so that you know what the information that's there. You have your name, your certificate, the contract, and your relationship. If you have a question, this is the number you call, the 1-888-663-6623. That's the number you call to get any questions. You start saying, am I covered for this? What happened to my claim? Oh, I didn't get my card. That's the number that you call. Now, under that, right here, this is for the pharmacy and the dentist. It's for them only. That's their code number to know what to put in what to put into the system so that it goes through. So if they say, well, I don't know, I don't understand, just say, listen, this you should know, and they should know what this means. So you shouldn't have to explain it to them. On the back here, I would say if you're outside the country, there's global medical assistance and there's phone numbers. If you have an emergency, it's strongly recommended that you call that number because they will help you in whatever country you're in order to help you with the costs. Very important. And in case you lose the address to submit a claim form, this is the address here. You send it to the Ottawa address. Now, let me help you with the claim form. We are we've now been paying claims for a month, and one of the problems we're encountering is probably not from Victoria, but it's probably from other areas, is that all we're getting is your receipt. So a student's going to, let's say, a massage therapist, and they're sending us the receipt. Nothing else. Do you know what that means when we get that and there's nothing else but the receipt? We don't know how to process the claim because we don't have, all we have sometimes is the name, and we have no number, we have no address, we have nothing. You have to fill out the claim form and give us a minimum amount of information. And the minimum amount of information is your name and your number. We need at least that. We can't process a claim if we don't have your name and number, because then we don't know who you are. And then you're going to call us and say, I sent my massage therapist claim, I haven't been paid. Well, we don't know who you are, so how can we do that? So please keep that in mind. It's a very simple thing, but it's important to us because we want to be able to pay you. We want to pay you in 5 days. We want you to get your money back, but we have to know who you are. So attach the claim, your name, and at least your number, and we will then be able to get your claim processed.
Can we do it online or?
Not yet. It's something that we're hoping with time that we can get to that point.
But I think the claim is already online.
The claim form is online.
Yes. So you can print it out, fill it out, and then attach it.
That's right. You can send in a claim by fax. So that is something that you can do. You could also scan a claim and send it in by email. But again, scan your claim form, scan your receipt, make sure your scan is clear. Because we can't, if we're looking and we can't see because it's not a good scan, we can't do anything with it. So the better you give us information, the quicker we can get back to you and reimburse you. Very simple.
So you are saying that it can be either or, so by mail or by email?
Yeah.
Okay.
What was your email? It's right there.
Yeah, I'll get to it. It's not in a card, but I'll get to it later. So there's a claim form, and so here's the minimum information. The name should be here, and you got a certificate number. Your certificate number is very easy. It's your Saudi ID number. So you give us that, at least we now know who you are. And address is important, especially if you moved. If you didn't move, well, that's fine. We have your address in system. But if you move, it's important for us to have your address because then at least we know how to get in touch with you if we have to send you something. Then you fill out this information, especially if it's a claim for you, that's easy. We know who you are. But if it's a claim for, let's say, your spouse, we need to know that. So we just ask that you give us the information on your spouse and take it from there.
Excuse me?
Yeah.
You just said that the certificate number is our Saudi ID number?
Yeah.
I think it's totally
Is
different.
it different? So
Yes. I think the policy number is, the certificate is the policy number. This is not an ID. Or the Saudi ID starts with 1, and this is...
You're right. I thought you're right.
I
You
think
got
this is
a different one.
Yeah.
That's right. No, it's not your Saudi ID number. I'm sorry. I apologize. That was our number to get you enrolled. I apologize. So you got the number. It's the number that's on your card. I'm sorry. So just use the card and put that number into that space. Thank you. Go ahead. The bottom part of the form is usually filled out by the practitioner. So if you go for massage therapy, they would fill this out. But sometimes they don't. They just give you the receipt because the receipt has all the information we need anyway. So you just send the receipt and attach it. It's usually that simple. Now, we talked about your reimbursements. I won't talk about that too long. It says there that it takes up to 14 days. We have up to 14 days to pay, but it doesn't take us that long. So we just want to let you know that in case it does take a little bit longer. It all depends on the time of year. You have 15 months to submit a claim. So in other words, from the time that you've incurred a claim, you have 15 months to send it to us. If you sit on a claim for 2 years and you send it, that'll be too long, you won't be reimbursed. But I know that if you paid out your money, you're going to want it back. So you probably won't be waiting 15 months to send in a claim. 15 seconds, yeah. All right, the website. So we invite you to go to the website because it has some very important information that you could find useful. It's also where we update plan information. So the website is found at this address, and you will find this, and you will enter the website. I'll go to the website. There. Once you're on the website, there are 2 areas that you can go to. The first area is what we call the Client Access Center. That is your personal site. When you go into that area and you register, you will have access to your information. So you'll get your profile, you'll get any claims that you submitted, they will be on the system. So it's a personal space that contains your information and contains also any claims that you have requested. But it also gives you information on any dollars you have not spent. For example, vision care. So you spent, I'll just say $150 on eyeglasses, and you forgot that you spent that and you're not sure how much you spent. You go into this area here, it'll tell you you spent $150, you still have $250 to spend. So it gives you some good information in that regard. The other site I'll come back to is what we call our provider site. That's if you're looking for a provider who has billed us directly in the past, that provider will be on that site. So again, that's a useful resource for you. So let's first of all go to what's here. So I'll just get you to. No, just move on to the right there. When you go to this site, obviously you would not have registered because this will be the first time that we see you. So we have to know who you are. And so what you do is you put in, you just go here and say, I'm a new user, and you click register. And then you'll be asked to register, you'll be asked to give the information that's on your card, your name, your ID number, and then you'll be given a password. It's a long password. So that's your first password. Then you come back to this site, put in your username, put in the password we gave you, and you simply go in, and you'll be into the portal, into your space. And then, of course, then once you're in, you can change your password to something that you can recognize. I think that most of you know how to use the internet and passwords in that regard. Next slide. Move it to, there you go. The other is a healthcare provider. So if you're looking for a provider who has billed us in the past, this is where you'll find it. And so what you do is you simply put in your certificate number. You don't have to put in all this information. Just put in your certificate number, and you just go submit, and it'll bring you right into that space. And here's what you'll see. So it'll ask you where you are. So, for example, if you're in Kamloops, you're in Victoria, you put that, and then you press enter, and then all the providers in Victoria will show up. And if you say, well, listen, I don't want all the providers, I just want to know doctors. So you just click on doctors, and then only doctors will appear. And if you want to click on, well, let's say I need an X-ray, well, then only X-ray labs will appear. So you have a choice too. So this is a very useful tool to help you find some providers that will bill us directly. Now the list is upgraded all the time, and right now in Victoria we don't have 5,000 providers in Victoria at the moment. We have a few, but that should not discourage you. You should revisit this from time to time. We have a person that works full-time on this, and so it's upgraded. New providers are added all the time, so you just don't know when there might be an addition. So I would encourage you to check as often as you can. And how do you get in touch with us? Well, there it is. You can send this by mail. There's our address. There's the 188 number, which is available from 8 to 5 Eastern Standard Time. I know that here in the West Coast, that's a little bit of a problem. That's the best we can do. You can always leave a message. We do have a message service in which we then will return your call within 24 hours. You can send us a fax. There's a fax. And if you want to email us, there's the email. So that's the information in terms of reaching us. And all that is on the portal, so you can also, if you don't have it here and you didn't write it down, it's on the portal, you can get it at that. What's the cost to you? There is no cost to you for the program. The cost is paid 100% by the Cultural Bureau and the Ministry of Education. And now I have to remember that question.
If you lose or someone stolen your card?
Oh, okay. If you lose your card or it's stolen, then you should call us right away and we will send you a new card. And we will produce the card, not this one, we'll produce the card the same day. And we will put it in the mail, so you should get it very shortly. So again, if the mail hopefully is quick, you can have it in a very quick period of time, but you should have it within a week because we will produce it right away.
Just a good point to remember, to remind our friends to, if they change their address, change their apartment, they should refresh them.
Their parents or they have separate
Okay, children have one card under BC Healthcare. Under the Saudi Arabian Healthcare, they have their own card.
Yeah, but I tried to apply, but it doesn't show anything. When they call you as a citizen, they say it's covered under you.
Really?
Yeah, I'm not sure.
Okay, you see me after. All right. Yes?
You advise us if she is covered under the Saudi culture bill, yeah? Your woman or your wife.
Yes.
And she is out of the country. It should be included under my name or? It should be handled under my name or she should be registered as student or registered as follower in the Saudi.
Well, the thing is that if you have a spouse, the spouse is either registered as your dependent or, but she's not in the country? No, she has to be here in Canada.
Is the, excuse me, is the ambulance covered? Ambulance service?
Ambulance is covered, yes.
Yes, totally covered.
Yes.
I just received the question.
Yeah. Okay.
If I have been living in Victoria for more than 6 months and I didn't have medical insurance, however, my study permit will be ended after 4 months. I'm still eligible for BC medical insurance? Say it again. If I have been living in Victoria for more than 6 months
Yes.
and I didn't have medical care, my study permit will be ended after 4 months.
Yeah, so in other words, if the study permit ends in 4 months.
Yeah.
Yes.
I'm still eligible for BC medical insurance.
Yes, you are.
Through your respective company.
Yes,
If I apply through your.
yes, until the termination of your study permit.
Is it
Yeah.
at the end of the study permit or the scholarship?
The end of your BC healthcare is study permit. Saudi Arabian plan is the end of the scholarship.
I see.
So,
But I think it's required for BC medical insurance that 6 months you should be left for you to stay in the country. Yeah?
that's right.
But what about if I just have 4 months?
Oh, you're only here for 4 months.
I would be here for 4 months and then I will go back.
Okay, if you're only here for 4 months, then the Saudi plan covers you instead of BC Health. Then you do not apply for BC healthcare. You only apply for BC healthcare if your study permit is more than 6 months.
Excuse me.
Yep.
يا شباب إذا واحد عنده سؤال ما يستطيع يترجمه اعطونا الان وليس بعد اللقاء، بعد اللقاء ما راح يكون في وقت كبير.
أول حين يسأل إذا.
اي اعطونا سؤالكم بالعربي ممكن ترجمه اذا ما يستطيع، ما فيها حياة. انا اشوف ما شاب يسال اسئله يعني وانا على جنب، لا اسال عادي ما في مشكله. يعني دونت هيزيتيت. لا حد يتردد، اذا عندك سؤال ما تستطيع تسال بالانجليزي عطنا بالعربي ترجمه له.
لو تسألوا لنا عن بطاقة البي سي هل احنا المفروض ندفعها؟ ولا هم راح ينسقون مع
هو لسه وضحها قبل شوي بالنسبه هو وضحها. البي سي كارد يا شباب مسألة حكومية، إجبار الجميع لازم يطلعها، اللي ما طلعها لازم يطلعها. من 1/2 الماضي هذا من 1 فبراير الشركة ترسل له في نموذج الآن راح نستلمه منه نعبيه من 1/2 وبعد ذلك هم يغطون، هم يدفعونها، يتفاهمون مع بي سي يدفعونها لك. من قبل ذلك المتأخرات عليك تدفعها أنت وترسلها للملحقية يعوضونها لك.
نتواصل مع البي سي.
أعيد مرة ثانية عشان تكون الصورة واضحة. قبل 1 فبراير متأخرات عليك بي سي، متأخرات عليك تدفعها وترسلها للملحقية يعوضونك عليها. بعد 1 فبراير تعبي النموذج اللي عندهم وترسلها للشركة وهم يكملونها لك. معلش دقيقة سامع.
الفاتورة الآن اللي جاتني مثلا الشهر هذا
حق فبراير تعبي النموذج وهم يدفعونه. Any bills that comes after 1 February 1st will be sent to you for refund.
أستاذ محمد لو دفعت أنا
He already paid the fees for February. Should that be refunded for him?
Yes. Did you send in? Have you been refunded those fees?
He just sent.
He just
he didn't pay BC.
Then he sends it to us, and we'll reimburse him.
يعوضك عليها على تحط عليها نموذج تعويض ترسله له. أي أسئلة شباب؟ أي سؤال؟
Where we can get the application?
I have some.
You have some
And we have some applications on the portal.
online.
Yeah.
طبعا يا شباب التأمين البي سي مانديتوري بمعنى إجباري إلزامي. البي سي ميديكال كارد إلزامية، اللي ما دفعها ما بعد سجل فيها يعتبر مخالف للقانون الكندي في بي سي، مخالفة قانونية. هذا تو قالها قبل شوي، مخالفة قانونية. فأي شخص يبي يروح الآن ببطاقة التأمين الجديدة هذه يروح إلى أي مركز صحي في بي سي يطلب يعني علاج أساسي ما راح يغطى، اللي يغطي الأساسيات البي سي. فأنت مجبر على البي سي الآن، لابد أن يكون معك، لأن هذا إلزام بمقاطعة بريتش كولومبيا، لابد أنك أنت يكون معك التأمين الخاص بالمقاطعة. بالإضافة إلى الأشياء اللي ما يغطيها البي سي كارد، مثل الأشياء بعض العمليات، بعض الأدوية ما يغطيها، وبعض الأسنان، بعض المبالغ الأسنان تغطيها الشركة هذه. إذا رحت المركز الصحي تعطيها البطاقتين يقول لك أنا أحتاج هذا فقط، ثم جاك الخدمة قال لي ادفع أن الشركة البي سي ما تغطي، توريه التأمين حق الشركة الجديدة يقول والله هذه الشركة نحن ما نتعامل أو إحنا ما ناخذ أي شركة تأمين أخرى، ادفع لي كاش وتتفاهم معهم. تدفع له كاش، تاخذ نموذج التعويض موجود على موقع الشركة، تعبيه مع الريسيت حق أو الوصل حق الفاتورة، ترسله لهم يا عن طريق الإيميل سكانر أو ترسله لهم بالبريد. How many bills can be included in one form? Only one for each? Each form is one for one?
No. When you make a claim, you don't have to have one claim form for every claim you make. If you have let's say if you have a claim for a massage therapist and you have a claim for somebody else, you could all add it to
I
one.
want twice the chiropractor and massage. So I need all this.
You put it together. Yeah.
شاف بس في نقطة مهمة يعني حاليا اللي صاير وشو أو قبل ما تبدي الشركة هذه الواحد جاء لازم يقعد 3 شهور عشان تجيه البي سي
لحظة مو لازم يقعد، لازم يقدم أول ما يجي.
يعني لو قدم أول ما جاء ما يعطونه إلا بعد 3 شهور من حالة وفاة في كندا. فهذه البي سي تغطي المستشفيات بس ما تغطي الأسنان. فأنت 3 شهور هذه لازم تكون معك emergency card اللي هي معطوك إياها المعهد أو كذا. حاليا إيش؟ سواء الشاب اللي معهم بي سي أو اللي ما معهم بي سي. الشركة خلاص الحين تعبي نموذج شركة حق شركة واحدة. حق الشركة هذه تجيك على طول اللي تمشيك حق الفترة وبتجيك بعدين حق بي سي. معناها بيصير عند كل واحد طاقتين. ما يحتاج تروح تقدم على بي سي لأنهم هم بيقدمون على اسمه. الشيء الثاني ما يحتاج تروح تدفع البي سي لأنهم هم بيدفعونها. فأنت في هذا الحالة خلاص تريح موضوع التعويضات والحقيقة والأشياء تنساها يعني.
حتى تأمين البي سي؟
حتى تأمين البي سي. فأنت الحين أول ما تسوي الواحد في الموقع حقهم حتى لو جتك البطاقة لازم تدخل الموقع عشان تعبي الابلكيشن عشان تجيك حقة البي سي وتجيك شركة. حتى لو عندك بي سي لازم تعبي الابلكيشن عشان ما عاد تجيك فاتورة على حسابك، تجي فاتورة على حساب الشركة وهم يدفعونها عنك. بس هذه النقطة اللي حبيت